Welcome to The Explainer. Today, we're diving into something a lot of us probably think is pretty simple, applying skin medication. But believe it or not, there's a right way and a wrong way to do it, and getting the technique right is absolutely crucial for your health. So let's walk through how to do it perfectly. So you might be thinking, it's just cream, how hard can it be? Well, how you apply it can literally mean the difference between it working or not. A bad technique can actually make the medicine less effective, or even worse, cause some nasty side effects. That's why we're going to demonstrate the right way to master it. Here's our game plan. We'll kick things off with prep, then get the patient ready, nail the application itself, tackle all the different types of meds, and wrap up with aftercare. Let's jump in. All right, first things first, preparation. Just like anything important in life, if you don't get the prep right, things can go sideways. These first steps are the foundation for everything, so you really can't afford to skip them. It really comes down to three things. First, know what you're working with. Why was this specific medicine prescribed? Second, and this is huge, double-check the medication administration record, the MAR. You're confirming the drug, the dose, the frequency. If anything feels off, you stop right there. And third, get all your supplies ready, but only for one person at a time. That's how we prevent mix-ups. Okay, so your supplies are all set. Now let's shift our focus to the most important part of this whole equation, the person you're caring for. Their safety and comfort, well, that's priority number one. This right here, this is your non-negotiable checklist. You've got to confirm you have the right person. Then just quickly explain what you're about to do. Make sure they're comfy and have some privacy. Next, wash your hands. Super important. And finally, take a quick look at the skin where the medicine is going. You're checking for any irritation or issues before you even start. And now we're at the main event, actually applying the medication. This is where the science of the medicine really meets the art of giving great care. Getting the technique right is what makes it all work. A big part of that technique is knowing what kind of medication you're using. You're not going to put on a powder the same way you'd stick on a patch, right? So let's really master the little details for each one. It sounds kind of obvious, doesn't it? But it's so important to remember that the form of the medication, whether it's a powder, a lotion, a cream, or a patch, is going to tell you exactly how to apply it. Let's look at the specifics. Okay, this is where the details really matter. With powders, the skin has to be totally dry, otherwise it'll just clump up. For lotions, especially suspensions, give that bottle a good shake first. And then you want to apply it with nice, even strokes in the direction the hair grows. That simple trick helps prevent irritation. Now for creams and ointments, here's a great pro tip. Warm it up a little in your gloved hands first. It makes it go on smoother and, avoids that cold shock for the patient. Now, speaking of different types, when we're talking about transdermal patches, there's one piece of safety info that is just absolutely critical. Seriously, getting this right can be a lifesaver. So here's the deal, and it's a big one. Some of these patches have tiny amounts of metal in their backing. If someone wears one of those during an MRI, that metal can heat up and cause some really severe skin burns. So it is absolutely vital to tell the MRI staff if a patch is on. No exceptions. And you might think you're done once the medication is on, but not so fast. The job isn't over. These final aftercare steps are every bit as important for safety and for making sure the medicine works. These last steps are pretty straightforward, but you can't skip them. Help with clean clothing so the medication doesn't get all over the place, get rid of your supplies the right way, and wash your hands again. Then check in with the patient, see how they're doing, and finally document everything. What you did, when you did it, and anything you noticed. All right, so if you're going to remember just one thing from all of this, I want it to be the 3 C's. It's a simple little framework that's going to be your key to doing this safely and effectively every single time. It's really that easy. First, you check. Check the medication, check the patient, check the skin. Then you apply with care, using the exact right technique for that medicine. And finally, you complete the job. Clean up, assess, and document. Check, care, and complete. You got this. This whole demonstration really shows how a task we all think is simple is actually packed with these critical little details. And it kind of makes you wonder, right? What other routine health tasks are we maybe taking for granted? What else deserves a closer look?